Assalamualaikum and hello everyone, especially Miss Ira. My name is Muhammad Zulfazli and joining me today is my partner Abdul Rahman. Together we are honored to present an analysis of mental health care performance in Malaysia. Our discussion will focus on two critical aspects: mental health, the prevalence of mental issues across different demographics. This is the first one. And second is public satisfaction with mental health services and its implication for service improvement. I will begin by providing the background and analysis of the prevalence of mental health issues. Then Abdurrahman will continue by exploring patient satisfaction and concluding our presentation. Mental health is the cornerstone of a functioning society, impacting individuals' ability to learn, work, and contribute meaningfully. In Malaysia, mental health issues are increasingly significant, with 1 in 3 Malaysians affected. This calls for an in-depth understanding of the challenges at hand. Let us start with the background. Before we start with the background, we move first with the credibility. Let me share why this topic is particularly meaningful to us. Through my own college experience, I observed the challenges in Malaysia's mental health care system. Many students, including a close friend, struggle with stress and anxiety caused by academic pressures. Issues such as long waiting time for appointments highlight the need for better support system. This experience motivated me to advocate for improved mental health services and to raise awareness to reduce the stigma associated with mental health in Malaysia. So we move to background of topic. Sorry. Mental health performance evaluate how well mental health services meet the population needs. It is critical measure of public health, assessing both the prevalence of mental health issues and the effectiveness of care provided. Globally, mental health disorders such as anxiety, depression, and schizophrenia contribute significantly to disability and reduce quality of life. This condition also impose a substantial economic burden due to healthcare costs and lost productivity. In Malaysia, the rising incidence of mental health issues reflects a pressing need for accessible and effective services. Next is central idea. The central focus of our analysis is twofold. First one is to examine the prevalence of mental health issues across different age groups. Second is to evaluate public satisfaction with the services provided and offer recommendation for improvement. Now let's move to the data on the prevalence of mental health issues. So this is our first graph, and this is the description of the data. So we move to the analysis of data. Let us now examine the data on the prevalence of mental health issues across different age groups as shown in the bar chart. First is for children aged 5 to 15 years is 12.1% prevalence rate. This age group has the lowest prevalence of mental health problems. However, the early identification of mental health challenges in children is critical, as these issues can escalate over time if left unaddressed. Contributing factors could include academic pressures, bullying, or family-related stress. Introducing mental health education in schools and early counseling can help prevent long-term problems. Second is for adults aged 16 above is 29.2% prevalence rate. Adults have the highest prevalence rate, representing nearly a third of this demographic. Work stress, financial instability, and lifestyle-related issues are major contributors. Adults often juggle multiple roles and responsibilities, making them particularly vulnerable to mental health conditions like anxiety and depression. This finding emphasized the need for workplace mental health programs, flexible work policies, and accessible counseling services. And lastly, for elderly aged 16 above, is 24% prevalence rate. The elderly population has the second highest prevalence rate after due to loneliness, chronic illness, or the loss of loved ones. Social isolation and declining health exacerbate mental health issues in the groups. Intervention like community engagement programs and senior care services could be highly beneficial. As you can see, the data clearly shows that adults are the most affected demographic, followed by the elderly. This finding highlight the need for target intervention tailored to the unique challenges faced by each age group. So I will now hand over to my partner, Abdul Rahman, who will provide an analysis of patient satisfaction and summarize the implication of our findings.
Thank you, Zulfazli. So before we move, let's see our second chart, our second graph. This is a second graph. So we move to the description of the graph. Yeah, this is description of the second graph. So now let's us move to the analysis of patient satisfaction with mental health services. As shown in line graph, the first is at 2014 satisfaction rate is 97.5%. This high satisfaction rate indicates that most patients were content with the mental health care services provided. At this stage, services likely met expectations in terms of quality, accessibility, and staff professionalism. However, the data does not account for specific areas needing improvement. The second, at the 2015 satisfaction rates is 97.8%. The satisfaction rates increased slightly to 97.8%. Staff marginal, these improvements suggest positive developments in service delivery. Factors contributing to the increase could include the implementation of new mental health policies, improved appointment management system, or enhanced staff training. So for the implication of the data, a consistent satisfaction rate above 97% boosts trust in the mental health system, encouraging more individuals to seek help. However, it also sets a high standard requiring the healthcare system to maintain or exceed the performance. Areas exceed these performance areas such as accessibility to understand population, reducing stigma, and increasing workforce density remain critical for sustaining high satisfaction rates. So, the graph shows that patient satisfaction is an important indicator of the mental health care system performance. It highlights the importance of continuous improvement to ensure quality care for all patients. So we move to the conclusion. In conclusion, while Malaysia's mental health care system has shown progress, there remains a pressing need for continuous improvement to ensure it adequately serves all segments of the population. Limited access to mental health services persists, with young people and urban residents being disproportionately affected. So to address these challenges, we propose the following recommendation. Develop preventive mental health policy. Develop preventive mental health policies. Focusing on early intervention and prevention can reduce the onset and severity of mental health conditions. Next is increase mental health workforce density. Expanding the number of trained professionals will help meet the growing demand for mental health service. And the last but not least is revamp appointment management system. Streamlining this system can significantly improve accessibility and reduce waiting times for care. Implementing this measure will enhance the quality, accessibility, and efficiency of mental health care services in Malaysia, ultimately improving the mental well-being of the population. So that's all from us. Thank you for your attention.
Thank you.